Good morning, good afternoon, good evening, wherever you are, and welcome to this IA2030 WHO and TechNet webinar series, on life course and integration. This is our fifth session, if I'm not mistaken, and today we will focus on schools platforms for vaccination status checks and catch-up opportunities. You can listen to this presentation in French. To do so, please use the globe that is at the bottom of your Zoom window. For the francophones, it's the title of it is Interprétation, and select the language. If you struggle with interpretation, please let me know in the chat. You can use this chat box for any technical issues, and I'll be here to help you as much as I can. And of course, you can introduce yourselves, as I can see many of you are starting to do. So please don't hesitate to let us know where you're from, and this will make us really happy to know who's with us. If you have any question during the presentation, please use the question and answer box, the Q&A box. For the francophones, it's QER. We will answer these questions, or the panelists will answer the questions after the presentation during the Q&A session. So don't hesitate to ask at any point if there's anything that triggers any question on your side. Finally, we are recording this session, and as per usual, we will share with you the links to the video as well as the slides. Everything is on a TechNet 21 webpage. I will send you the links probably today or tomorrow once we have the video up and the presentation as well. I hope you enjoy this session, and I'll give the floor to Stephanie.
Thank you, Alex, and welcome everybody. Welcome to our now fifth webinar in this series of webinars on life course and integration. I'm really excited to present this topic to you today, and we have three presentations in store for you today. As Alex mentioned, the recordings will be shared afterwards, but I also want to remind everybody that all previous recordings from the webinars that have already taken place, as well as the presentation materials, are available online on our Life Course and Integration webpage on TechNet. I'll provide the link to that in the chat, and it's also on the slide at the end of the presentation. So you'll be able to find today's recording as well as the previous ones in case you've missed them there. So we have a packed agenda today. I want to get going right away. First, we'll hear from Kirsten Ward from the US CDC, and then we'll have a presentation from our colleagues at the Ghana Health Service. Grace Eddie Amawu will be presenting Ghana's experience with school vaccination checks program. And then finally, we have a presentation from our colleagues in China CDC. We have four colleagues on the line today: Yi Jai Kai, Dr. Zhu Wenju, Lance Rodwald, and Lili. So I'm really looking forward to today's session. I hope everybody else is as well. And I will hand it over to Kirsten now to get us started. Kirsten, go ahead.
Thank you, Stephanie, and good morning, good afternoon, good evening, everybody. I'm here today to give a brief introduction to school vaccination checks, a topic for which I'm very passionate about, and thank you to the colleagues at TechNet and WHO for organizing this webinar and providing the opportunity to share information about this topic. Next slide. So we're going to get started with some definitions about school-related vaccination activities. You can see here there's four definitions which we'll use throughout today's webinar and in general when we're working with school-related vaccination topics. The first one is school-based immunization, with which you'll be very familiar, which is about delivering one or more routine doses of vaccines in a school setting. The one in green is school vaccination checks, the topic of our webinar today, also sometimes referred to as school screening, which is the process by which one is checking vaccination records of school-age children, looking at whether they've received the routinely recommended vaccines, and then providing an opportunity to catch up missed doses. The other definitions we'll be using on the right side of the screen is school health screening and prevention, is generally screening for health conditions or delivery of preventative health interventions that is conducted on a school premises. So this is more broad than immunization specifically. And then finally, school vaccination requirements, where one requires proof of vaccination for entry into formal childcare or school setting. Specific exemptions may be in place for these particular requirements, but they are usually required at a national level and implemented as such. We'll go into a bit more detail on these in a minute. Next slide. So the process of checking vaccination status at entry to or during school is a strategy that's recommended globally and regionally. You can see on this slide pictures of the IA2030 agenda and a couple of documents related to disease-specific programs within the global space, particularly measles and rubella, and then the tetanus elimination guidelines. And both these documents really highlight the opportunity of checking vaccination status at school and catching up on missed doses as important to achieving disease elimination and eradication goals. And then on the other side of the screen, you can see the WHO position paper on measles, which clearly recommends children should be screened for their measles vaccination history at the time of school entry, and those lacking evidence of measles vaccine provided with the opportunity to receive this vaccine. And this is echoed in the WIPRO and the Euro strategic documents guiding vaccine preventable disease elimination and eradication throughout these regions. And I understand will be forthcoming in other regions' guidance as they are developed. So just to highlight how widely recommended this strategy is at a global and regional level. Next slide. So why do we think this strategy is important? As it provides an opportunity to do many different things as outlined on this slide. It most importantly identifies children that have been missed by the immunization program and provides them an opportunity to receive missed vaccines. This in turn leads to enhancement of population immunity to vaccine preventable diseases. It includes completeness of immunization data and immunization information systems as they're able to add the data from the missed vaccines to those systems. Promoting home-based record retention, which is key to be able to check vaccination status, is having a record of one's individual vaccination history. And so requiring that provides also an opportunity to strengthen the retention of these records. Also, this strategy, as we'll hear from our colleagues in Ghana and China, does require cooperation between health, education, and early childhood sectors, among others, across both government and private sector. It also has the opportunity to improve health and vaccination literacy in schools, both for teachers and students who are involved in the checking process and the catch-up vaccination process, and ultimately creates a healthy school environment to optimize learning. Next slide. So as I mentioned earlier, these two terms about school vaccination checks versus school entry vaccination requirements can often be used interchangeably or confused, but we wanted to be clear about how they are different. And this slide provides some explanation of that. You can see here, school entry checks can be used to enforce laws or policies that require proof of vaccination for entry into schools. However, the checks can also be implemented without such policies requiring vaccination for entry to school to identify and provide opportunities for those to catch up on missed vaccines. So there isn't necessarily a need to have a law or policy requiring proof of vaccination to implement these checks and provide opportunities to catch up on missed vaccines at school, as we will see from our colleagues in China and Ghana, where the school vaccination checks are done outside of requirements for vaccination to enter school. Next slide. So this slide shows the prevalence of checking vaccination status at school being implemented by country in 2021. It's data from the WHO-UNICEF joint reporting form, where countries answered the question of whether they implement school vaccination checks. You can see in blue the 123 member states, or 63% of member states, implemented these checks in 2021, either at a national or subnational level. And then the countries colored in yellow are those that stated they do not implement these checks in 2021. And then some data from about 16% of member states was not available. So as you can see, the prevalence of implementation of these vaccination checks in schools is wide, with almost 2/3 of the world implementing them to some extent in 2021. And we look forward to seeing the new data on this as it comes in towards the middle of this year. Next slide. So there's opportunities to check vaccination status at different stages of the education system. So the first you can see here is entry into childcare or daycare, which targets children 0 to 3 years of age, or infants and children of this age group. Then there's opportunities at entry into formal preschool or primary school. The terminology used depends on the country, but essentially the entry into the first formal years of education that's required in the country. And this is usually around the ages of 4 to 6. Then there's entry into primary school, which is perhaps a little bit older, children of 5 to 7 years of age, and then also entry into secondary school. But not only entry is a time when the vaccination status can be checked. Such checks can also happen during childcare, primary or school, including during the delivery of routine vaccines to these target age groups, perhaps as a result of VPD outbreaks. Campaigns are also an opportunity to deliver additional doses above the routine requirements to children at school, and also during broader health screening programs where vaccination might be a focus. So there is a variety of different opportunities where vaccination status can be checked at various different entry points into the education system, and then during the education system as well. Next slide. So like any system, there's things that have to be in place to make the system feasible. We've learned from many of the countries that have been implementing checking vaccination status at school that these are certain things they feel is feasible, that makes this strategy feasible for them. The first is support from the Ministry of Education and other relevant sectors of government. Given the strategy is implemented in the education setting, that collaboration is integral to make this strategy operational. Having a high school enrollment rate is also important, as you're able to reach the largest number of the target age group in one setting. And being able to understand the levels at which enrollment is differing across different schools and different school years is also important in understanding which year would be best to target the strategy. As I mentioned earlier, availability of home-based records of vaccination, i.e. something to check, is important, and relying on written records of vaccination, whether they be electronic or paper-based, is critical and more advantageous than recall alone. So existing laws or policies also help with feasibility. These might not necessarily be requiring vaccination to enter school, but rather laws or policies promoting the importance of checking vaccination status and providing an opportunity for children to receive missed doses of vaccine during such checking processes. And there's other laws or policies which are required to make the catch-up vaccination feasible, such as a broad age range policy that allows children of school age who have missed vaccine doses to receive them, as these can sometimes be prohibitive if not sufficiently wide to include school age children. So also having the available workforce is important, a system for forecasting vaccines and supplies that will be needed to meet the catch-up demands, approach to delivering of the missed doses and making sure that there's a feasible solution to enable the children to access the vaccines that they've missed, whether that be through referral or delivery of the vaccines at the school site, and having the appropriate things in place for consent. And then also looking at the integration of this activity with existing school health activities, such as health screening for a broader range of conditions, or school-based immunization delivery of other routine vaccines targeting school-aged children. So just rounding out this feasibility slide is some things that we've heard from countries that make this strategy feasible for them. Next slide. So in terms of factors that facilitate the school vaccination checks, we've heard from many of the countries implementing this strategy that there are several things they feel really help them implement this strategy. Again, strong collaboration between the ministries of health and education, and clear roles and responsibilities designated to each of those, right from the national level to the service delivery level. Certainly availability of sufficient funding and staff time to be able to implement the activity, clear implementation guidance and standard operating procedures, as we'll hear more about from our colleagues later, availability of up-to-date home-based vaccination records, as I mentioned earlier. Also, the ability to communicate about this strategy to the target audience, mainly the caregivers of school-aged children, as well as key opinion leaders and community-based volunteers who really help mobilize the population and support implementation of these checks, as well as routine monitoring of not only the processes, but the outputs and outcomes, and have this supported by existing immunization information systems and other data gathering systems that are available in the country. We'll also hear about the results from these efforts from Ghana and China. Next slide. So whilst there's many facilitating factors to success of this strategy, there are also some barriers that have been identified. Again, sort of the inverse of the health and education sectors being supportive is perhaps insufficient support and consensus from them. And this can really take time to build, especially if it's a new strategy and something that is perhaps not widely implemented in the country, and there's a lack of health activities in the school population in the country. Can be a long journey to getting sufficient support and consensus. A lack of clear and permissible catch-up vaccination policies and guidance for children in the target age group. As I mentioned earlier, this is really key to allow children who have been identified as missing routine vaccines to receive them as catch-up. Also, having standard operating procedures and guidance, lack of these leads to inadequate implementation and often sort of delays the opportunity to receive missed doses. Some of the low availability of home-based vaccination records and trying to understand how we can obtain those records through other means, such as looking at immunization registers based at the facilities. No processes or responsibilities for following up of children. This is really important to have these placed in the SOPs so that there's clear understanding of who will be responsible for following up with the caregivers to ensure children have received their missed doses. There's also limited evidence to guide planning, implementation and monitoring of this strategy, especially in low and middle income countries. We're really excited to hear some of the evidence from Ghana and China today, which has been critical to guiding efforts of designing, implementing and evaluating this strategy in low and middle income countries. And finally, just thinking about sustainability from the start. When thinking about implementing any strategy, one has to be conscious of making it as sustainable within the existing resources and infrastructure. So it should become part of the fabric of the immunization program and the school health platform, and not be seen as a one-off separate effort. But this will acknowledgingly take time to build and achieve, but it's important to see it as from the start when planning. Next slide. So that brings me to the end of my presentation today. And I will now hand it over to colleagues in Ghana, particularly Grace, who will present on the school health in Ghana. Thank you.
Thank you, Christine, for the opportunity. Good morning, good afternoon, good evening to everyone. This is Grace presenting on behalf of Ghana Health Service. This is our presentation outline. Next slide. So a brief background about Ghana. Ghana has a population of 30.8 million and under 5 population of 6.4 million. The student population of the country stands at 424,940. In Ghana, we have 16 regions with 261 districts. Ghanaians use both national health insurance and then private health insurance. Next slide, please. School health is targeted at younger ones like those who are in school, who are of school-going age. And in Ghana, we have both public and private school. Next slide, please. So the school health of the Ghana Health Service is an integral part of the child health program under the Family Health Division. As a direct outcome of Ghana's ratification of the UN Convention on the Rights of the Child in 1991, the Ghana Education Service and Ghana Health Service were mandated to introduce an integrated comprehensive school health program. In 1992, they were given the role to implement and then provide health services in schools as part of the child health program under the Ghana Health Service. Next slide, please. So one who asks, which people do we target as school health service providers? So the school health program targets preschoolers, basic schools, including senior high schools, junior high schools in the country. Next slide, please. The objective of school health program in Ghana is one, to ensure that every school child is as fit as possible, to also ensure that we have early diagnosis of diseases and recognition of any disability for early, timely, effective, and appropriate management, to make the school a healthy place for learning and play, as well as promote growth and development among school children. The objective is also to promote knowledge, skills, attitude of learners, caregivers, teachers, and health workers through our health promoting activities in the school environment. Next slide, please. So when a child is in school, as a service, we ensure that the child benefits from a minimum package of service. There are other services that can be provided to the child in school, but at least among all the services, these are the minimum that a child benefits from. It includes general physical examination that looks at examination from head to toe, immunization and vitamin A status assessment. This has been highlighted for the audience for this presentation. We also do hearing, speech, and growth assessment for the students whilst in school, provision of first aid, health education, counseling services, referral, and follow-up are the minimum package that a child benefits from in the school setting. Next slide, please. We have various agencies who have a stake in the provision of school health, but key among these agencies in the country are the Ghana Health Service, Ghana Education Service, Ministry of Rural, Local, and Rural Development are the key players in implementing school health services in the country. Next slide, please. So what brought about the introduction of screening for children in school? For us as a country to be able to assess and have a database on the health status of students or children enrolled in school for the first time, it became necessary for us to have these students screened. So we introduced screening for new entrants. And this screening was piloted in the year 2018. It is done annually at the beginning of every academic year. Next slide, please. What do we have to share as a country when we introduce screening for new entrants? A lot of processes go into the planning and implementation stage for screening of our students. Before we begin, we organize in-session meetings, and these meetings target partners, stakeholders who have a stake in school health, and this includes academia as well. Preparatory meetings are held where training materials, screening tools are reviewed and worked on. Orientation and sensitization are held for health workers, staff, parents, community leaders, and anybody who have a stake in the screening activity. Capacity building are done from as high as from the regional level, targeting the screening teams as well. The tool for screening is also piloted, and then the screening itself is done. As the screening is done, there's monitoring. The monitoring is done during the screening and after the screening. All information or data gathered on the students during the process are entered onto a software. The data is cleaned and analyzed. It is then validated for reports writing. These reports are written and further dissemination sessions are held where results from the screen are shared with all who are involved. Next slide, please. So for the screen to take place, this is another interesting thing that we would like to share as a country. The names of all students to be screened are listed in the various schools across the country. We also send notification letters to parents, to teachers, community leaders, and whoever, and partners as well, who have something to do with the screening. Each student or each learner is allocated a screening form, and this form are kept in the school with the class teacher. And the class teachers are given the go-ahead to fill the learner's biodata on the form before the screening team arrive for the screening. Where this is not done, the health workers are also given the go-ahead to fill the screening form. The child's maternal and child health record book is also collected and kept in the school. Where it is not collected, we encourage parents to bring it along on the day of screening for us to use to pick the biodata and all information necessary for the screening. Learners who are found to miss vaccines on the screening day are vaccinated immediately at the screening sites or in the school. If it is not possible, they are being referred to the appropriate health facility to be screened. Next slide, please. So this is a sample of the screening form. Next slide. One may ask, so far, what progress have we made? So the progress made as a country since the introduction of school health screening in 2018 is that we have been able to implement the screening in all 16 regions in the country in 2019, and more than 500,000 first entrants were screened. Due to the COVID-19 outbreak in 2020 and 2021 academic year, as a country, we couldn't do screening. But we are happy to mention that this academic year, 2022 and 2023, screening has started in Ghana. Screening has resumed in Ghana, but this is done in only one region. This is because of the SOP that was developed from the previous screening and is being piloted at this very region as the screening is ongoing. And we are looking forward to scale it up to all the remaining 15 regions in the country. Next slide, please. So this is a pictorial view of a team assessing screen status and vaccinating some of the students in school. Next slide, please. So we'll appreciate the work of CDC and Affinet for helping us to conduct an evaluation of the screening that was done. The objective for the evaluation was, one, to understand the knowledge, attitude, and practice for vaccination checking components among health workers and education staff. The second one is to assess the short-term effect of checking vaccination status as part of school health screening in the country. Next slide, please. So what is the method involved in this? We sampled 82 schools, and in these 82 schools, a total number of 1,779 children were listed for their immunization status to be screened. But as the months go by, the number increased to 1,009 since there were new enrollments. Their screening status was checked by obtaining information for their vaccination record books. And where this is not possible, the team relied on the health facility vaccination register to extract information on students' immunization status. In the absence of these two, caregivers are also contacted to verbally give information on the immunization status of their children. The information collected are later captured on the red cap. Next slide, please. At the end of the day, the 1,900 students that were selected, we were able to assess the vaccination status for 1,884. And it will interest all of us to see that 63% of these target set children whose vaccination status were assessed falls within the age group of 24 to 59 months, which is the target for our vaccination as a country. Next slide, please. So from the evaluation, this is what we found. That Ghana as a country have a high vaccination status for the first year of life. When the evaluation was done, 628 children were found to miss vaccine. And this gave Ghana as a country the opportunity to have all those children to receive the various types of vaccines that they have missed. But we were able to give 28 of these children who missed the different types of vaccines. So out of 628, 28 of them received their vaccine. One may ask, why did we leave out the 600 children? Probably is due to our staffs who are not fully abreast with the catch-up policy. Next slide, please. So in the midst of all this, we face some few challenges. And among them is the disruption in school academic calendar due to the COVID-19 outbreak, funding, poor telecommunication, poor road network, poor appreciation of Ghana's vaccination catch-up policy among health workers, as I mentioned earlier on, few schools refusing vaccination, and we also have some few parents also refusing vaccination for their wards. Next slide, please. So in our way forward, we are looking forward for adequate funding to be able to identify the gaps in implementation of vaccination in the country to help improve upon the vaccination program. We are looking forward to integrating or intensifying the screening of vaccination status into the routine health, school health services, to also initiate collaboration with other agencies like the social welfare. We are looking forward to share our findings from the ongoing 2022-2023 evaluation with everybody if the opportunity comes. Next slide, please. So in conclusion, we'll say as a country, the policy on health screening for new entrants into school system has come to stay, and it is going to be conducted annually in the country. We want to say thank you to everyone for your attention. Thank you for listening to Ghana. Thank you all. We acknowledge the following: Ghana Education Service, AFINET, University of Ghana School of Public Health. We also acknowledge the U.S. Center for Disease Control and Prevention. We say thank you.
Thank you so much, Grace. That was really interesting and very efficient delivery through your slide deck. So thank you so much for that. Over to our colleagues in China.
Okay, good evening, dear professors. It's my honor to introduce the vaccination record checking at school entry in China with my colleagues, Dr. Yuan Zhou, Dr. Lance, and Dr. Li. And I will give the presentation. My colleagues can give supplements anytime. My presentation includes 6 parts. And next slide, please. The first background includes 3 parts. Next, please. And the relevant laws and regulations in China from 1984, we have issued the announcement of school entry checking policy, which required the children to provide a vaccination certificate when entering school. Until 2005, on the base of 1989 and 1991, we issued the notification about school entry checking program. It is a very important regulation. And in 2015, China CDC have issued technical guideline for school entry vaccination checking program. And in 2019, we issued a vaccine management law. And in 2021, we issued the document about the school checking. Next. In 2014, we got the support from WHO. The project areas included 3 provinces and 1 city. We investigated the current status of school checking in 2014, and they explored methods to evaluate the vaccination rate of children enrolled in school and the implementation effect of school checking. And we also made a nationally unified implementation plan for school vaccination checking, which provided the basis for the technical guidelines issued by China CDC in 2015, and the documents for school entry vaccination checking issued in 2021. Next slide. In the process of revising the documents for school entry vaccination checking, we get the support from WHO. The photo is our investigation in ancient Hubei province in 2017. And the next slide. We also have some new rules in vaccine management law. The format of vaccination certificate is stipulated by the National Health Commission and unified throughout the country. The National Health Commission and the Ministry of Education jointly formulated the record checking methods. Next, please. The documents for school entry vaccination checking have mainly four new rules. Clarified the responsibilities of health authorities, education authorities, CDC kindergartens, schools, and the vaccination clinics. Specific rules were made for the notification of checking students, assignment of the status of vaccination, catch-up vaccination, and data management and reporting. And we also encourage clinics to provide services for checking by means of information technology. After the start of a new semester, the checking should be completed with 1 month. Relevant materials should be placed into student health records and school health materials. Next, please. And we also integrated the vaccination status and catch-up vaccination assessment into vaccination certificate. The next, please. The second part, current status. Next, please. Or checking student and the unit. The units for checking are nursery, kindergarten, and primary school. Local authorities can expand the scope as needed. For example, Beijing, Shanghai, Guangdong province include high school, and all children newly enrolled, all transferred to school must be checked. And for the first time, the nurseries which provide the service for children under 3 years old have included in the checking. Next, please. Checking vaccines include BCG, polio, HEPB, DTaP, and so on, and other vaccines that included the vaccine abroad component. Provinces can increase the types of checking vaccines according to its local immunization program and immunization procedures. Next, please. Checking time, spring and fall of each year. Local government can determine the specific frequency and the time of checking according to their need. Next, please. The checking process before school starts, school inform parents to go to the vaccination clinics to have the assessment of vaccination status through manual or information system. after school starts, schools check vaccination status, told the parents to bring their children to have the catch-up vaccination in clinics. If not finished, schools will send notification forms for catch-up vaccination to the parents to give the reminder for vaccination. Next, please. And we also established aggregate information reporting. School and vaccination clinic record checking information is aggregated and reported through the education system, the CDC system, and the health department at all levels. Next, please. Our experiences included mainly 4 parts. Next, please. First, using immunization information system to simplify the checking process. In China, nearly 20 provinces using the IIS to check the status of vaccination for children entering school. More than 10 provinces have enabled parents to conduct assessment through their own mobile phone app by themselves. It is very convenient. Next, please. The second, we will publish the school checking and knowledge of vaccinations through radio and TV, media, WeChat groups, child vaccination day, and many other ways. The third, we have training. Local health and education departments will formulate the training plan and organize carry out it. Strengthening supervision. In some areas, the 2 departments will organize the touring supervision to improve this work. Next, please. The effectiveness. The next, please. We have mainly 2 effectivenesses. One is the routine immunization coverage is maintained at a high level in recent years. Since 2021, we began to collect the national checking reports, which shows that the checking rate of children remained at a high level of more than 98%. The checking rate increased further after the 2019 vaccine management law was enacted. Next. And the second, the vaccines against the infectious diseases have been decreasing year by year. Take measles, for example. As we know, most measles emergencies occur in schools. And from the figure, we can see that the number of measles emergencies have been decreasing year by year from the surveillance of public health emergency reporting information system. Next, please. And we also have some difficulties. The first is the mechanisms of vaccination certificate checking in some areas still needs to be improved. And second, it can be difficult to obtain some migrant children's vaccination records. We found most migrant children are missing vaccination information or have no knowledge about the catch-up vaccination protocols is not always consistent. Some areas have a strict assessment criteria. Children who were older than the starting age of vaccination and did not reach the age of catch-up vaccination are included in the target group, which result in the low rate of catch-up vaccination. Next, please. And our next steps are followed. First, we will continue to strengthen communication and coordination between the health and education administrations and improve the degree of emphasis of the education administration attaches to this work. And second, we will strengthen the training. The third, we will encourage the optimizing of the checking process through information technology. The fourth, we will formulate the reference standard for the evaluation of catch-up vaccination to unify the understanding of catch-up vaccination in different places. And next, please. That's my presentation, and thanks to IA2030 group. Thanks to everyone.
Thank you so much. Thank you so much to all of our presenters today. And I'm glad to see that we actually do have a few minutes left before the end of the call to do a few questions and answers. Thank you for typing your questions in the chat. I see that some of them have actually already been responded to, but we can elaborate on these a little bit in plenary since we have time. So we had a question about what to do when children are missing their health records. And so I see that Charles from Ghana has responded that the first step is to check the routine health records in case there are vaccination records for that child at the facility. And if not found, then they ask for recall from the mother as a third option. I'm wondering if China, I know you mentioned at the JK, you mentioned on your slide a few slides back that there are sometimes challenges when you have maybe migrant children from outside of the system, so there isn't an electronic record available, or other reasons why history cannot be verified. Maybe China, Jikai, would you be able to tell us what the process is if you can't verify a record? Is the process to offer revaccination, or how do you handle it when there's no record available?
Thank you for the question. As I know, this is one of the most difficult question in our country, and we will. I think we can tell the children's parents to go there rather than places to check the information, and through the information system, immunization information system to get the information. As far we haven't the right method to solve this problem. But that's all.
Yeah.
Thank you.
Maybe we can get more information about this question. So in China, the first step for the migrant children, we tell their parents to go to their hometown to get the vaccination information from the IIS. Up to now, each province have the completed IIS. So maybe they can, almost all children can find the records from the information system. The second method is for the China, we wanted to set up the comprehensive IIS immunization information system. So each province, other province can share the immunization records to the another province. So if the one child moved to another province, so they can also get the immunization records from the hometown province. So maybe we can solve this problem. Thank you.
Thank you. Thank you very much for that clarification. Indeed, a digital system, I'm sure, really improves the ability to locate this data over a paper-based system. So absolutely, that's one of the feasibility considerations when Kirsten mentioned those at the beginning of the presentation. A robust data system that can actually provide these records is a prerequisite to having a functional vaccination screening program, and certainly digital systems really help that a lot. But also one thing that Kirsten did mention that I just want to reiterate is that this strategy, having this strategy in place, really has the ability to promote better retention of home-based records in the long run. So, setting up a system like this, you might run into problems in the first few years of implementation, but the longer a system like this is in place and the more that caregivers can anticipate needing to have those records, it can improve retention of the home-based records as a result. So it's a secondary benefit. So I think we're getting to the end of the call, and I know that our interpreter will be leaving us, so I do want to wrap up on time. Thank you so much to everybody for joining. This is the last scheduled webinar that we have on deck right now, but we are aiming to have another one in June, probably on adult vaccination platforms. And so please stay tuned. You will be receiving an email as soon as that date is finalized. Everyone registered for this one will be registered for all subsequent webinars. So please do continue to share this link with your networks, encourage people to register so that they will receive information about all future webinars under this series. A reminder that all previous recordings can be found on our webpage. The link is there in the slide, and Alex will be sharing all of this out with you in the coming days. So thank you again. Thank you so much to all of our presenters and for all participants for joining. Have a great day.
Thank you.
Thank you, everyone. Have a very nice rest of the day.
Thank you.
Thank you. Have a nice day.
Thank you.